In today's class, we will study antacids. Here, what is mean by antacids, and here in this topic, we will study the how the antacid word is derived, definition and classification of antacid, mechanism of action, therapeutic uses, and adverse effect, advantages, and disadvantage. This much we'll studies in today's topic. First of all, antacid, how the term this word is derived, that we will study. If you split the antacid, it becomes the anti plus acid. Anti means against, acid means the gastric or hydrochloric acid in the stomach. Here the antacid term are the antacid are the drugs or a substance that act against gastric acid by neutralizing it. Whatever the gastric acid, hydrochloric acid is in our stomach, it is there, that is neutralizing it. The substance or a drugs which acts against the hydrochloric acid or stomach acid, that is called as a antacids. Okay, now the definition, the next topic is definition. What is mean by antacid? The definition is antacids are alkaline substance that neutralize the gastric acid or hydrochloric acid. Okay, here simple meaning is that antacid are the alkaline substance or any substance which are having the alkaline in nature, those neutralize gastric hydrochloric acid and increases gastric pH. You know, the in the stomach the pH is 1 to 2.5 or maximum 3 pH it is there. After giving these antacid substance or drug, then it increases the gastric pH up to 4 to 6. Like this, the drug is helpful for the neutralizing here. Now, what is the relieving? What are the things it is relieving? By relieving the hyperacidity. If you give the antacids, it helps for the relieving the hyperacidity, heartburn or burning sensation in the chest, as well as the peptic ulcer symptoms also it will relieve. This is about the definition of the antacid. Now the next topic is classification of the antacid. Antacids are mainly classified into two types. One is systemic antacid, second one is a non-systemic antacid. Systemic antacids are absorbable. It means that it is absorbed in our body, completely absorbed and act. The whole in the systems it will act. Non-systemic antacids are those are non-absorbable substance. It is not absorbing, just whatever you are taking the drugs, that is only acting on the stomach and expel. Like this, the non-systemic antacids are the only non-absorbable substance. Now first is systemic antacid. This contains the mainly the sodium bicarbonate. The very common tablet is available. The brand name is Sobosis tablet is available. This is one of the systemic antacid product. Okay, next one is the non-systemic antacids. Very commonly, those are aluminium hydroxide, magnesium hydroxide, magnesium trisilicate, and calcium carbonate. These are the common non-systemic antacids. You know, that is the aluminium hydroxide is the all these magnesium hydroxide. Aluminium hydroxide is the common side effect is the constipation, and magnesium hydroxide the common side effect is the diarrhea. These are the classification of the antacid. Now the next is mechanism of action or mode of action. How the antacids acts in our body, that we will study. The first thing the antacids it will do, that is neutralizing the gastric pH present in the stomach. Whatever the gastric pH is, it is increase or neutralize it. This is the main function mechanism of action the antacids will do. The next one, increase the gastric pH about 4 to 6. The that is 1 to 2.5 or 3 pH it is there in the gastric. It increase the gastric pH. These antacid increase the gastric pH about 4 to 6. Next, reduce the pepsin activity. Whenever the acid level is decreases, then our body the pepsin is increased. The pepsin is activate, that is helpful for the breakdown of protein. If it is reduce the drugs, these are reducing the pepsin activity, the main function. The next one, provide relief from heartburn and epigastric pain. These substance, antacid substance or drugs which helpful for the relieving the heartburn as well as the epigastric pain. This is about the mechanism of action of the antacid. Now therapeutical uses. In the what are the diseases these antacids we are using for the treatment? The first is the hyperacidity. Whenever patient suffering from the hyperacidity, the here antacid we are prescribing. The next one, GERD, gastroesophageal reflux disease. That is the whenever the acid increases, acid comes to up to the esophageal, that is the GERD diseases. In that cases also antacid we are using. Next is the peptic ulcer. There is the ulcerations in the stomach. In that cases also these antacids are using to relieve the symptoms. Next one is the dyspepsia. Here also the for the digestion also these antacids using. Next one is the heartburn or burning sensation in the chest. Antacids we are using. Gastritis, inflammation in the gastric or inflammation in the stomach, also the antacids we are using. These are the common diseases we are using antacids. The next one is the adverse effect. What are the adverse effect if we are using the antacids continuously? The first is aluminum containing antacid. If you are using the alone aluminum containing antacids, the common side effect is the constipation. The patients of the adverse effect or adverse effect produces the patient suffering from constipation as well as hypophosphatemia. This is the common side effect. And next to, if you are using magnesium containing antacids continuously, then the chances of the diarrhea, the patient regularly if they are using the magnesium antacids, then the common side effect is the diarrhea. The next one is the calcium carbonate. Already you know the calcium carbonate. If you are using the hypercalcemia or acid bond is, these are the adverse effect produces. The next one, sodium bicarbonate. Already we studied, that is the systemic antacid, sodium bicarbonate. The common continuous for long time you are using. Then metabolic alkalosis as well as belching. These are the common adverse effect if you are using these antacids. The next thing is the advantages. What are the advantages of using antacids? The first is the rapid onset of action. It will show immediately, rapidly, it is doing the actions. The next one, quick symptom relief. The patient is suffering in the heartburn or epigastric pain. Like this, if these symptoms are there, then you can give the common medicine like Gelusil or Digin syrups, Digin tablets, or as well as mucin gels, that's oxygen containing anesthetics, as well as aluminum and magnesium antacid. This will helpful for the quick symptomatic relief. The next one, easily available, because antacids are easily available in all the pharmacy or medical shop, and it is inexpensive. Cheap drugs are there, easily available. These are the advantages of antacids. The next one is the disadvantages of antacids. It is a short duration of actions. It means whenever you are giving the short duration, limited time only they're acting. The next one, do not eradicate the cause of ulcer or disease. If you are giving antacids, it is not treating the cause or not treating the any ulcer as well as the gastritis, just symptoms only for few hours only. The symptoms relieves but not treating the complete cause. This is one of the disadvantages. Next is the may cause drug interactions. If you are giving antacids, it will combine with the other drugs and may chances of the interactions are there. Adverse effect of the if you are adding with the other drugs, the common side effects may arise. These are the adverse effect of antacids. This is about the short explanation of the antacids. Hope you understood. If you understood, please share to your classmates and your friends. Please like, share and subscribe. Thank you.